the year 2024. There is tons of data on the internet. There are tons of speakers. There are tons of YouTube videos. Everyone has opinions. Everyone is saying everything and anything all over the place. Dr. Mcdougall, you have real world experience. You've been doing this for 50 years. You've been in African countries where you were the only doctor treating 1,500 people. You have an incredible background. You've written books. You have people seeing you. So the question I'd like to ask you is, what happened? What happened to all the people who ate the whole food plant-based diet? Did they all get rid of diabetes? Did they all lose weight? Do some people still get heart attacks? Do some people still get cancer and die? Like, what is the actual result if someone says, I went to the conference, I changed my diet, I exercise, I sleep, I do everything you tell me. Do we live to 115? Like, what should we expect if we do this?
No, you won't live to be 115. The lifespan of a human being is 85 years. We published data in 3 studies that looks at our results over 7 days and also over a year-long period of time. So we have data. The average weight loss in 7 days is over 3 pounds, eating as much as you want, as often as you want. Average drop in cholesterol is 22 points. Nearly 90% of people are able to get off their medications, particularly blood pressure and diabetic medications. We reduce fatigue, lower insulin levels, lower all your risk factors, get people moving again. So, you know, we have data to substantiate what happens. You ask, Steve, why everybody's confused. Well, it has to do with several things, and I'll just mention a couple of them. The main one is money. Okay, it all comes back to money. Secondarily are people's egos. And the third thing is people can't see past their own dinner plate. That's some of the problems. There are a lot more out there too. But I think if you focus on money, you've pretty much got the answer to the problems and the solutions. So anyway. And I just want to mention, I learned my really rural practice of medicine out in the country on the big island of Hawaii. And I took care of 5,000 people over a period of 3 years. That was back when I was a real doctor. I used to push drugs. But these days, I've cared for over 12,000 people. As you mentioned, I've been at this for over half a century. And you know something, Steve? I'm the luckiest doctor in the world because my patients get well. It used to be my patients got drugged and got a bunch of excuses. That's basically it. But my patients get well. Why do they get well? Because we deal with the problem. What's the problem? It's the food. What's the correct diet for people? All you have to do is look at science and history and geography, and you can figure this out. Or you can look at your religious teachings. I don't care where you look. It all comes out to the same answer. The human being is a starch eater, a starchivore, a starchitarian. Essentially, well, all large, successful populations of people through all of verifiable human history have obtained the bulk of their calories from starch, like the Native American, potatoes and corn. Central America, the Aztecs and Mayans were known as the people of the corn. South America, the Incans were potato eaters. In the Middle East is known as the breadbasket of the world. Bread, not pork chops, the breadbasket of the world. And you can all relate to the Far East and their diet of 90% rice. Starch is the key for you getting control. Not plants, not vegetarian, not vegetables, although the diet we teach is pure vegan and low fat. You have to focus on these elements of rice, corn, potatoes, breads, pastas, etc., and then you get control. Otherwise, you're lost and sick and suffering.
Thank you. Dr. Helman, you also have had a lot of experience with real world people. You've worked at True North. You've worked at Hippocrates Health Institute. You do a lot of research to find what evidence-based answers. What have you found the results of people? What has happened from doing all the things you're saying to do?
Yeah, so it's really exciting that in my experience, which unfortunately isn't 50 years like Dr. Mcdougall, but in I would say 10 or 20 years, I have seen numerous chronic diseases reverse using plants, using a plant-based diet. And, whether that's, and I'm also a big fan of fasting when it's appropriate. So the good news is that there are other options than the traditional system that's being offered by American medicine. And but let's just be clear, this is a different paradigm. The paradigm that most people in this country have are you wait until you have a chronic disease, and then, and only then, do you start investigating and trying to reverse it, as opposed to being aware that there are many things you can do to prevent these chronic diseases like high blood pressure, obesity, diabetes, Alzheimer's, etc. And if you take action early, you can prevent these diseases.
Okay. According to Michael Greger's research, consumption of nuts is associated with reduced risk of premature death, making them an essential component of a diet aimed at promoting longevity. Dr. Greger highlights walnuts in particular for their omega-3 content and potential in improving artery function. Do you agree? And what are the health effects of a diet high in plant fats like raw seeds, raw nuts, avocados, and olives? What are the pros and cons? Wait, both of you with this question.
Okay. Should I go
Go ahead.
first? All right.
Sure. Why not?
So my perspective is it depends. It depends on the patient, but in general, yeah, I'm a big fan of walnuts and other nuts and seeds. But the problem I found for myself and my patients is that they can become addictive, as in the correct dose for many people is going to be a handful, 1 ounce of walnuts or something like that. Whereas I don't know about you, but if you put a big bowl of walnuts in front of me, it's hard for me to stop at just 1 ounce. But let me be clear. There are some of my patients that I've seen who actually have the problem of not being overweight, but are underweight. And in which case, they need more calories, and it's reasonable to take more than 1 ounce. But let me give you another example. It's not just walnuts, it's other. I saw at Hippocrates, on avocado night, people would pile 3 avocados on their plate, and that would be their meal, and they would not lose as much weight as when, if they only took, an eighth or a quarter of an avocado. So in general, I agree that walnuts have important omega-3s and other nutrients, but for most people, you have to focus on moderation, which would be, an ounce. So that's my perspective.
Well, I'm one of your, or I could be one of your patients that needs to add nuts to their diet. And I do. I eat, well, I probably eat some days 800 calories of nuts trying to gain weight, but it doesn't work with me. I no matter how many nuts I seem to eat, it doesn't work. First thing I would like to say is that nuts and seeds and avocados are not unhealthy. They're generally healthy, but the problem is they're 90% fat and they're loaded with calories. So, as mentioned, some people have a hard time and they gain weight. I happen to be probably one of the exceptions. The other thing you need to understand is you don't ever have to eat a nut or a seed or an avocado. There's plenty of omega-3 fats in all your vegetable foods. There's never been a case of omega-3 fatty acid deficiency ever described in science or in history based on diet. It's never happened. The only time you've had fatty acid deficiency is in the extremes. People who've had horrible accidents and they've lost their intestinal tract and they can't absorb fat. Or people who have terrible illnesses like Crohn's disease. In that case, yeah, but otherwise, no diet would fail you. You'll always get enough omega-3 fats on any natural diet. So, for those who are guilted into, they need to get their omega-3s, stop it. It isn't necessary, and it may lead you to an excess amount of body fat that you don't desire. So we consider nuts a delicacy in our program.
Is there, if you were giving advice to someone on how to prevent Alzheimer's, what would you say?
Wow, where to start? I would talk about maybe 5 different categories, making sure that not only that people eat the right diet, specifically avoiding animal products and eating plants, but I would also focus on things like making sure they get adequate exercise, that they decrease their stress levels. And what has come out of the data, the recent data I've seen, is that the number one risk factor for the development of Alzheimer's is actually poor sleep, specifically deep sleep. So in connection, for whatever reason, having good connection with friends, family, and others seems to be protective for Alzheimer's. I mean, we could talk for hours on this topic, but I think the important topic is that, or point is that, fortunately, Alzheimer's is preventable despite what you may have heard from the traditional media or narrative currently about Alzheimer's. And I know we were talking beforehand, Dr. Mcdougall and myself, that, I mean, he's written papers, et cetera, about aluminum, unfortunately being one of the causes or the cause of Alzheimer's. So obviously, that being true, you want to limit your exposure to aluminum.
Well, I think first you have to realize the medical business is not going to save you. Their new drugs are extremely expensive, costing $26,000 to $52,000 a year. They're extremely ineffective, and they're extremely toxic. In fact, they're a great controversy in the medical business. And, the fact that they came to the marketplace is a bit surprising, because if doctors and scientists were being honest, they'd have never let it happen. But it's a business issue. Alzheimer's, in part, is due to the Western diet. But, that's only a part of the factor. What happens when you eat the Western diet is you're eating an acidic diet. And that acid nature that's created in the blood and in the bowel makes aluminum more absorbable by the human intestine. If you look at Alzheimer's disease, it's diagnosed, it was first diagnosed in 1903 by Louis Alzheimer, who found a lady with rapidly progressive dementia. And he looked at her brain under a regular microscope, and he found this characteristic plaque called a senile plaque. And then over the next 20 years, there were 33 cases of Alzheimer's. And then World War II came along, and we started using aluminum in everything. It became a readily available metal. And then it got into the millions, where they predict tens of millions of people will get Alzheimer's in the upcoming years. Let's get back to that plaque that Louis Alzheimer discovered in 1903. When you look at that plaque carefully, under a microscope, what you find is that you must see this plaque to diagnose Alzheimer's. It's called a pathognomonic lesion. If you don't have the plaque, you don't have Alzheimer's. And when you carefully look at these plaques, like with an electron microscope, you delve inside of them, you find that they all have a central core of aluminum silicate. You don't have the plaque without the aluminum. You don't have Alzheimer's without the plaque. We also have research that was published in the 80s where aluminum chelating agent called deferoxamine, when they gave people shots of deferoxamine for 2 years, they ended up reducing their progression of disease in half compared to a control group. They did twice as well, those that got the shots. Now, the problem with the shots, deferoxamine, you can look up on Amazon or on Google. It's available, but it's pennies. I just told you these medications cost $26,000 to $52,000 a year. I've written 2 articles in the last 6 months, one to the New England Journal of Medicine, one to JAMA. When they came out with articles on drugs like Leqembi, which is one of these monoclonal antibody drugs, which is being hit in the press all the time, published a couple of articles, and I wrote them and asked them. I gave them the evidence on aluminum poisoning and Alzheimer's, just the stuff I just told you. And I asked them, why don't you at least study this? I mean, you're willing to study drugs that cause brain bleeding and swelling in 20% of the people. They're highly toxic. A third of the people have to quit the drugs. They can't take them. They get so sick. I said, look, why don't you at least study aluminum chelators? Because it does no harm. It costs nothing. And it is a cure, because if you believe Alzheimer's is caused by aluminum, you've cured the patient by relieving of the causative agent. Anyways, both times I've got rejected, but I'm going to keep trying. I'll keep sending them letters. But anyways, it's due to aluminum poisoning. That's what it's due to. And the Western diet has an influence too.